Namaskar and a very warm welcome to this edition of our program Let's Talk Health Neuro Queries. I'm Nidhi Kumar and you're watching India Science. As COVID-19 continues to surge in the country and across the globe, COVID-related queries are on the go. People are speculating about the booster doses, about the effects and vaccines and the precautions they need to take. In this program, where we take your questions from Facebook and YouTube Live, we are joined today by the very well-known Dr. Ayush Agarwal, Assistant Professor, Department of Neurology at the All India Institute of Medical Sciences, New Delhi. Many thanks for joining us today, sir. Welcome to India Science.
Thank you. Thank you very much.
Please tell our viewers something about the new variant XC and the kind of setbacks it can have, especially on the neuro side. And what are the protocols right now if we talk about protocols at the All India Institute of Medical Sciences, doctor?
First of all, I'll begin with the first question that is about the new variant that's coming up. So, it's lesser about the name of the variant and more about the fact that newer variants will keep coming up. That is so called the natural history of a viral infection that happens. The same thing happened 100 years ago, the same thing is happening now. So, after one strain comes, as the immunity to that strain is weaning off, a newer strain usually comes in. The good thing about that is that the successive newer strains that come in are usually more transmissible but lesser in severity. That means that, like we saw, that the first strain was delta, after that the predominant strain was omicron, so the omicron strain was more infective. That is, if somebody was exposed to it, he or she was more likely to get COVID infection.
I think we've lost the audio. We're just asking you about the effects of COVID on brain. Yes, doctor.
Yeah, so as I was telling you, so it is less likely to have gotten a severe infection with Omicron. Now, the next strain that is coming, it is also highly transmissible. Maybe it's even, more transmissible than the Omicron variant. But preliminary data as of now shows that the severity is not as much. However, it is not the time to bring our guards down. I know everybody feels tired and fatigued wearing masks all the time and maintain social distancing and all of those things, but till the time that we're out of this pandemic completely, we have to keep our guards up.
Yes, doctor. My next question is that are neuro disease patients more prone to this kind of infection, or is this a myth?
No, that's a myth because COVID infection per se is a respiratory infection. So, no neurological disorder per se will cause an increased risk to get that infection. Yes, it is possible that if you have one disease or one infection, then if you get another one, you may get sicker than somebody who does not have that infection. Say I am suffering from a brain disorder and I get COVID, I might get slightly more severe symptoms than somebody who was otherwise completely healthy and completely fine. So that is the only thing. The chances of a severe infection go up on the basis of the number of other disorders or comorbidities that you have. But this definitely is a myth that if you have a neurological disorder, the chances of you getting COVID are higher. That said, sometimes in some disorders, there are people on particular medications which are called immunosuppressants, in which we decrease the immunity of the body because sometimes that is required for different disorders. So, people who are on those drugs, that is immunosuppressants or steroids, they have a slightly higher risk of developing or getting infected with COVID. But otherwise, general day to day practice, neurological disorders like epilepsy, headache, all of these patients are unlikely to have a higher chance of getting COVID infection.
Yes, doctor. What about neuro and motor neuron diseases in children? Do they affect children if we talk of kids specifically?
Motor neuron disease per se does not occur in children. Rarely it can happen, but motor neuron disease is usually a disease of younger and older adults. So, in that, various symptoms are seen because the neuroaxis is damaged. It is a degenerative disorder in which gradually our nerves and the cell that is called the anterior horn cell gets damaged. The exact reason is not known. Various pathophysiologies have been provided and given regarding why this happens, which leads to eventual degeneration of all the structures that are associated with it, leading to chronic disorders and disability per se. Unfortunately, most motor neuron diseases as of today are not treatable. Various researches are going on. There are good leads that are coming in. But as of today, most people who have motor neuron disease have to live with it and eventually succumb to it, unfortunately. But hopefully that will change in the future.
Right, doctor. Tell us about the neurological diseases spectrum if we look at India post COVID.
Uh, a lot of things can happen with COVID actually. If we start with the mildest symptom according to the population is headache. So headaches can happen more frequently in a COVID infection, as I'm sure most of everybody who's got COVID will agree that it leads to loss of smell and taste sometimes, which can be very disabling but is considered mild. And on the exact other end of the spectrum, we have something that is can be a stroke. Like COVID can lead to a procoagulant state where the blood vessels supplying the brain can either get clotted, leading to a massive infarction, that is a stroke. And sometimes they can even lead to inflammation induced damage of the blood vessel, which leads to bleeding in the brain, which is called a brain hemorrhage. So that can also happen. Some people can get decompensation of their previous disorders, which means that somebody was previously suffering from, say, dementing illness, the subtypes would be a little too much. So let's say somebody had dementia, that somebody gets COVID, that dementia can get decompensated and the symptoms can increase. So although the COVID per se was not responsible for the dementia, but it can definitely lead to increase in the symptoms. Also, a lot of people with neurological disorders like Parkinson's disease and dementia are dependent on caregivers for all of their daily activities. Like somebody has a stroke, somebody has dementia, they need somebody to help them go to the washroom, they need somebody to help them change their clothes, they need somebody to feed them. But as soon as they get COVID, they get separated from that support system, which leads to a lot of anxiety, which leads to a lot of stress, both for the patient as well as the family. So the effect of COVID per se is manifold and cannot be just looked at as a linear equation that this happens, so this happens. That's the thing.
Right, doctor, you mentioned loss of taste, loss of smell. Some people have been complaining of loss of hearing also. Does that also happen? And you mentioned headache. Interestingly, we have queries about giddiness and vertigo in neuro. Could you please explain this in detail?
Yeah. See, viral infections are known to predispose to occasional dizziness, headache. Some people also complain of fatigue, but all of these things are usually mild and self-resolving. So there, even for loss of smell and loss of taste, contrary to what the public opinion is, that use some hot oil, use saline gargles, use some people do some local therapies. None of them are actually have been proven to be efficacious. Usually they are self-resolving, and somebody who has these symptoms just needs to be very careful and cautious and deal with them, and gradually they go away on their own. However, if somebody is having severe symptoms, there are drugs. Like if somebody is suffering from severe giddiness, we can give them treatment, some tablets which will help control and curb the giddiness. If somebody has headache, we can give them medications to, you know, cause the symptoms of headache to go away. And the same thing, somebody has fatigue, they can take a few days off work and rest for some more time, and the fatigue, the giddiness, the vertigo, everything will go away on their own. There's nothing specific that needs to be done. However, if the symptoms are disabling and severe, they should definitely consult a physician so that the appropriate investigations and treatment can be initiated.
Absolutely, doctor. What about loss of hearing? There are people who complain about a ear blockage like you have in an aircraft, and that kind of symptom carries on. Does that have anything to do with neuro?
Yeah, so the air blockage and loss of hearing are two different things, which I'm glad that you pointed out, because this needs to be clarified. Loss of hearing is a red flag. If somebody develops loss of hearing, that is inability to hear. I could hear something from my right ear completely normally, and suddenly now that I'm talking on the phone, I feel that I can't hear from my right ear. That's a red flag. Please go to a physician immediately, and you need to be tested. However, this feeling of a blocked ear that happens commonly with common cold also when you're taking a flight, that is a completely different thing that can happen with viral infections and happens because of inflammation surrounding a tube that connects the ear to our nasal cavity. So that will go away as the inflammation subsides, and that is not such a troublesome thing. But if you develop loss of hearing, please consult a local physician for the cause of the same.
We have a YouTube question now, doctor, and they wish to know that they're suffering from COVID, having mental confusion and memory loss. What medicines would be advised in such cases?
I would say that I can't advise any treatment directly because the symptoms seem vague. Somebody says memory loss. Memory loss can have multiple domains that are affected, can have one specific domain that is affected. So before I can say what treatment I can provide such a patient, I would want that patient to come to me or their local physician so that they can be a proper history can be taken. See, before we arrive at the cause and effect, we need to know exactly what is happening. Somebody says memory loss, that might just be कि आज मैंने फोन अपना यहाँ पे रखा था, मैं भूल गया फोन कहाँ रखा. And it can be something as sinister as that I've forgotten the way to my house. So the management of both of those things is completely different. So before I can say that some treatment can be given, I need to ascertain how severe is it, what domain of memory does it actually involve, and what is the treatment that can be given.
We seem to have lost the audio. Please bear with us for a second. We're talking about a YouTube question. Yes, doctor, please carry on. So, in
COVID
case
and
there is a red flag, you need to see a physician. Yes, that's
yeah,
what you were saying.
because just saying that one is forgetful and one has memory loss are two different things. People can be forgetful when they are inattentive. People can be forgetful when their mind is somewhere else. So that is not memory loss per se. Memory loss is the thing that patients with dementia have. I have forgotten what I had for breakfast. I have forgotten who is the person living at home with me. So there are two different things and carry two different connotations. So before I can say that this is the treatment for memory loss, we need to know how much is the memory loss, whether there is actual memory loss. So if this person who sent this YouTube question, I would suggest that person to please contact their family physician, local physician, and get tested. And if there's actually a disorder, we can definitely treat them and provide some counseling.
Right, we have another similar YouTube question, and I'm taking this. She says, my grandmother is showing loss of smell, taste, and hearing disorder. Is that related with neuro?
Yeah, definitely. And again, as we've been talking about this, somebody has loss of smell, loss of taste, please consult a doctor, because although COVID does cause it, it is not the only cause. So she needs to be tested, she needs to be evaluated, and she needs to be treated based on what the findings of the test show. And all of these things, any disease, it is not only about neurology. Medicine entails a proper history taking and a proper examination. People can share their symptoms, but till the time that we can take a detailed history about how that symptom started, how that symptom progressed, what were the associated symptoms that the patient has, and then testing for that symptom, till that time coming to a definitive diagnosis is difficult. So if there are problems, then please consult somebody who you're comfortable with, who you go to for all your problems. A
Right,
doctor.
doctor. Right, doctor. Could you please explain to our viewers what is Parkinson's disease and what are the symptoms and how do they need to know that there is a red flag and they have the same disease? Does it happen only in the elderly? If you could share a few insights about this, doctor.
Definitely. So, Parkinson's disease is a neurodegenerative disorder which comes under the umbrella term of movement disorders. It usually occurs in individuals who are above the age of 50, if I can say that, and it may rarely occur in younger individuals also, but it is extremely rare. And when it occurs in people, the symptoms that they develop is that they first develop a symptom that is called as tremor. उनके बैठे बैठे हाथ कांपने लगेंगे. अगर वो खाली बैठे हुए हैं चेयर पे तो दे विल कंप्लेन कि मैं बैठा हूँ या मैं बैठी हूँ और मेरा हाथ कांपता रहता है. एंड वो जो ट्रेमर है, वो जो कंपन है, वो कुछ करने पे यूजुअली चली जाती है. तो इसे रेस्ट ट्रेमर कहते हैं. इसके साथ साथ यू विल रियलाइज दैट the patient becomes progressively slow. अगर वो नाश्ता पहले 10 मिनट में कर लेते थे तो अब उन्हें नाश्ता करने में 15-20 मिनट लगने लगेंगे. अगर वो पहले वॉशरूम जाके नहा धो के 15-20 मिनट में आ जाते थे, अब उन्हें आधा घंटा 40 मिनट लगने लग गए हैं। एंड साथ में उनकी बॉडी रिजिड होने लग जाती है। जब आप देखोगे वो चल रहे हैं तो उनकी बॉडी एकदम स्टिफ हो गई है, जैसे एक लकड़ी एकदम स्ट्रेट स्टिफ होती है वैसे ही वो एकदम अकड़ के चल रहे हैं। तो इफ इन तीनों में से कुछ भी सिम्टम पेशेंट शो करता है तो आपको एक न्यूरोलॉजिस्ट को मिलना चाहिए, क्योंकि अगर पार्किंसंस डिजीज है तो उसका ट्रीटमेंट है जिससे पेशेंट को बेनिफिट मिलता है। तो these are the three most common signs of Parkinson's disease, symptoms rather.
Absolutely, doctor. And if you could now tell us a little about the Alzheimer's disease and what are the symptoms. And this is an English program, doctor, so we'd like to request you to speak in English, sir.
That's my bad. So, Alzheimer's disease is a cause of dementia. It is rather the most common cause of dementia. So, what happens in Alzheimer's disease, as with Parkinson's disease, it usually occurs in the elderly age group. Although, by definition, the elderly term is gradually going up further because the life expectancy is going up. So, I'd rather say that it occurs in individuals who are usually above the age of 60, 65 years of age. And patients develop intellectual impairment, which is most commonly in the form of memory. One common example that is commonly seen is that people will start forgetting where they've kept stuff. They will keep their mobile phone somewhere, their wallet somewhere, and forget about it, and then look for it frantically. And the family members, the caregivers, will come to the doctor with this complaint that they've become increasingly forgetful and they never remember where they've kept the stuff. Another common complaint that starts in Alzheimer's disease is forgetting the way in and around the house. If they have taken that route to go home from a shop or some place to their own house multiple times, even when they go for a walk, but suddenly they will forget what is the way to their house and get lost. And this is a very common history that the family comes with, that they've been living there for the past 15 years, but suddenly that patient has started forgetting what is the way to the house. In When the disease starts to progress, they can start forgetting their way inside the house also. So patient will wish to go to the washroom but end up going towards the kitchen and things of that sort. Finally, the patient can also start becoming a little withdrawn. The family will say that initially he was very jovial, he or she was very jovial, used to love to go to parties, used to love to call people over, talk to them, engage in stuff. There's a family there's a wedding at the home, they want to talk to the family members, help in planning everything that is going to happen, how they're going to happen. But suddenly they're completely withdrawn, they're sitting in their room, they don't want to watch anything. They had a favorite program that they would not miss for anything, but suddenly now they have to be coaxed to watch it. They have to be coaxed to speak to people, they have to be coaxed to do something that they really like to do before. So the personality starts to change. So these are the common symptoms with which a patient with Alzheimer's disease presents to us.
Thank you for so well explaining the same, sir. Now, doctor, please could you tell us a little about sleep disorders, multiple sclerosis, and is it possible to have these kind of disorders in children? What does one do?
I take one by one, because sleep disorders and multiple sclerosis are two completely different things. So multiple sclerosis is a neuroinflammatory disorder in which there is our brain has nerves which are covered with a structure called as the myelin sheath. So sometimes some disorders lead to destruction of that myelin sheath, and the myelin sheath is responsible for helping in the conduction of the nerve impulses. Just like we have thick wires which are covered with multiple coatings to help in the conduction of the current, similarly, our nerves have a myelin sheath to help in the conduction. So sometimes these myelin sheath get destroyed by various disorders and causes. One of them, and the most common, is multiple sclerosis. So multiple sclerosis is a disorder of the young, which is more common in women as compared to men. The symptoms associated with multiple sclerosis are many. One of the most common is vision loss. People suddenly develop painful vision loss. That is, they'll say that till a few days ago they were fine. Then they started having pain in the eye, which was associated with progressively decreasing vision. That is, 5 days ago they could see most of the things, but some of it was blurred. Then a few days later it became more blurred, and maybe 5, 7, 10 days later the vision from that affected eye is nearly zero. So that is the most common symptom of multiple sclerosis. and it can lead to other things also, that such as weakness of the hands, weakness of the feet. Suddenly you have no control over your bladder and things of that sort. So that is multiple sclerosis. If you have any of these symptoms, please consult a neurologist. Second question that you asked me was about sleep disorders. Now, sleep disorders can occur both in children as well as the elderly. There are people who talk in their sleep, which is called sleep talking. There is something called as a REM behavior disorder, where people in their sleep start enacting their dreams. And the most common and the most troublesome sleep disorder that we see is obstructive sleep apnea, where somebody is sleeping, but because they are obese, they have hypertension and various other risk factors, they start snoring loudly and they have an incomplete sleep. So the patient is not aware, but they end up waking up multiple times in the night, because of which they feel not refreshed when they wake up in the morning. So that is obstructive sleep apnea, and it is particularly common in people who are obese, that is very fat. They have hypertension, they have diabetes, and other vascular risk factors. So if you have this feeling that you sleep adequately for say 8 hours or 10 hours, but when you wake up in the morning, you don't feel refreshed per se, and you fit into the risk factor profile that I described, you might be suffering from obstructive sleep apnea and should be evaluated by a neurologist for the same.
Absolutely, doctor. If you could also explain to our viewers what is peripheral nerve disorder.
So peripheral nerve disorder. So one has to understand what are peripheral nerves to begin with. So from a brain and spinal cord, there are nerves that come out to supply our extremities. So the brain and the spinal cord constitute the central nervous system, and everything that comes out from that constitutes the peripheral nervous system. So these nerves come out from our spinal cord and eventually give innervation to our hands, to our feet, to our arms, forearms, everything. So these nerves can get damaged in multiple disorders, and the disorder is known as peripheral neuropathy. The most common cause of peripheral neuropathy is diabetes, because people don't take diabetes as seriously as they should. So when your sugar is poorly controlled, your blood sugar, it leads to eventual damage of these peripheral nerves, because of which we start developing symptoms. And all the viewers would probably agree, if they have somebody in their family with diabetes, the most common complaint is that they feel that they have this tingling or numbness sensation at the bottom of their soles. When they're walking, they feel that the ground is as if they're walking on wool or as if they're walking on a mattress. So the sensation from their soul starts to get damaged. That is the first step or the first stage of diabetic neuropathy, and is a marker that the diabetes is not well controlled, because of which the peripheral nerves have started to get damaged.
Right, doctor. We have a YouTube question now, and she wants to know her father got an attack 3 times, a stroke, and then he suffered from a neuro disorder. According to a CT scan report, his brain is degenerating. As you mentioned, he forgets locations, persons, current affairs, events, even sometimes the way in the house. Please tell me, is there any kind of solutions or what should be done?
So there are solutions. There could be solutions. I would like to tell the person who's asked the question that it is unfortunate that her father had a stroke, that is 3 times. And what everybody needs to understand is that one has a stroke for the first time, it's unfortunate. But after one has a stroke for the first time, the patient is started on medication which are called blood thinners. All the purpose of those medications is to prevent a recurrence of the stroke. And also, we control all the risk factors that are responsible for the stroke. The most common and the most prevalent risk factor, not only in our country but worldwide, is hypertension, that is, increased blood pressure. I cannot reiterate this enough, that blood pressure is something that should be controlled within the range that is described, that is the systolic blood pressure, that is the reading that you see as the upper limit on the BP reading, should be less than 140, and the diastolic blood pressure, that is the lower reading that comes on your BP apparatus, as less than 90. So this 140 by 90 is like a golden number that one should remember, and your blood pressure should always be below that. But what the unfortunate truth is that people don't take this seriously. You will have scores of patients who have been diagnosed to have hypertension. They're started on medications, so their blood pressure gets controlled. As soon as their blood pressure is controlled, they would discontinue their medication, saying that our blood pressure is now controlled. Why should we take the medication? But what needs to be emphasized and understood is that your blood pressure is normal because of the medications that you're on. As soon as you stop taking your medications, your blood pressure increases again. And increased blood pressure is the most common cause for a stroke as well as a heart attack. So please don't take blood pressure lightly, because on a day to day basis, it might not cause problems, but the day it leads to a stroke or a heart attack, it leads to massive problems. So that is the first part. So if somebody does have a stroke, they're on these medications. So mostly they should not have another stroke. However, in the unfortunate scenario that multiple strokes have happened, since multiple strokes damage multiple areas of the brain, it can lead to a disorder which we call vascular dementia or vascular cognitive impairment. That is, the multiple strokes leading to brain damage severe enough to cause this memory impairment. So, this impairment, although severe, can be treated to a certain extent. I would say that not the 100% functionality can be retained that was there before these strokes happened, but some benefit can definitely be provided, yes.
Right, doctor. Another question that comes to my mind now is what is a brain tumor in specific terms, and are there any non surgical treatments also to treat brain tumors? What would you like to elucidate on this? And who's at risk mainly for brain tumors?
So, I'm a neurologist. Brain tumors are primarily dealt with by neurosurgeons because it entails operations, but brain tumors are cancers of the brain, simply speaking. And there are various kinds. Some are not as aggressive, they're called benign tumors. Some are aggressive, and if not treated immediately, can spread to various parts of the body. They're called malignant brain tumors. Depending upon the site, the location, and the type of the brain tumors, the treatment differs and varies. And there are some non invasive methods of treating them, like gamma knife and radiotherapy. But all of that depends upon the type of brain tumor that you have and the location of the brain tumor that you have. Not all brain tumors can be treated by them. So, that is the thing.
Right, doctor. Could you also let us know what is a degenerative disc disease?
So, degenerative disc disease is uh, a disease of aging, and everybody, I guess, above a certain age develops a symptom of low backache. That is, the age that you get it is evidence of how much you've been taking care of your postures. Somebody who gets it at a younger age has not been taking care of their postures at all. Somebody who's developing it at the age of 80 has been very careful about their postures, their body weight, and their physique. So, long standing bad postures, obesity, and everything leads to uh, how would I say that? So there are, a spinal cord has multiple bones which are called vertebrae, and between every vertebrae we have a disc so that we can function properly. Because if it was just bones, we would be rigid and be unable to move. So as with aging, everything starts to have some wear and tear. So the amount of wear and tear depends upon how much you've been taking care of that stuff. So people who are not careful about their postures and are not careful about their physique, who are extremely fat, will develop it early, as I've said. So degenerative disc disease will present. These discs can, when they start to degenerate, will start sliding behind the bone and start hitting the nerves that are there in our spinal cord. So when they hit their nerves, we develop low backache, and a lot of people develop a complaint which they say that there is a radiating pain that goes from the hip to the foot. So that these are the prototypical symptoms that are seen in low backache. And low backache in all of these scenarios is mostly because of a degenerative disc disease.
Absolutely. And on that note, I'd like to thank you, Dr. Ayush Agarwal, for joining us and for sparing your valuable time in educating us. And with this, friends, this is a wrap on this edition of Let's Talk Health. We'll be back with more interesting episodes. Till then, stay vaccinated. That's the only way out. Stay safe. Do not let your guard down. Keep the mask up. On that note, namaskar and thank you for watching India Science.